Tonight, we're shining a spotlight on a really touchy subject up for debate in the Virginia General Assembly. When to end your life on your own terms. Thank you for being here with us tonight at 5. I'm Lorenzo Hall.
And I'm Simone D'Alba. Now, there's a bill on the table that would give severely sick patients the option to end their suffering with the help of doctors. Our Matthew Torres joins us to explain how more people, including doctors, are now speaking out against this so-called medical aid in dying bill. Matthew?
Well, tonight, Senate Bill 280 is in Virginia's Senate after it was passed by the Finance Committee on Tuesday. And tonight, we're hearing from supporters, including patients and opponents, who say it would set a bad precedent.
I think there's a hazard to passing this bill.
As a doctor in Northern Virginia, John Paul Verderesi says a bill supporting medically assisted deaths would create even more grave consequences.
I think once we introduce this as an option for treating somebody, it could lead down to paths that we just don't want to go down.
He argues there are already other methods in place to care for someone at the end of their life. But a Virginia bill that recently advanced in the Senate Tuesday would give patients that choice. If passed, a dying patient could be prescribed a controlled substance to end their life in what supporters call a humane and dignified manner.
I think the problem is when you introduce physicians and other healthcare providers into this act, I think it creates a conflict of interest, so to speak. So this has now become a treatment that can be abused.
If they oppose it, they don't have to use it. Nobody has to participate in it if they don't want to. But the people who want this option, they should have this option.
Sean Crowley's with the organization Compassion and Choices, advocating for better care options for the end of life. He recently lost his mother.
She was desperate for help to end her suffering, and I couldn't give it to her, and it was heartbreaking.
Medically assisted deaths are legal in 10 states and D.C. In a statement Monday, Bishop Michael Burbidge of the Catholic Diocese of Arlington said, in part, quote, "Assisted suicide facilitates tragedies and makes the most vulnerable even more vulnerable. Legalizing it would place the lives of people with disabilities, people with mental illnesses, the elderly, and those unable to afford health care, among others, at heightened risk of deadly harm." And if this passes, there are several conditions which include granting healthcare providers immunity from civil or criminal lawsuits, and there are a lot of protocols in place. You can learn more on WUSA9.com. Simone?
I know you'll continue to follow this for us, Matthew. Thank you. We'll check in with you for updates.